on stage with me. Okay, so let me introduce my panelists. So right next to me, I have Mr. Henry, who is a husband and father of 3. He has more than 40 years of experience in mentoring roles in the business field. So in 2024 February last year, he was diagnosed with colon cancer and underwent colorectal surgery. Since then, he's been an active volunteer with the Colorac Buddies Patient Support Group and Singapore Cancer Society. Okay. Next, I have Prof. Neo, who is a senior consultant and head of palliative medicine here at Tan Tock Seng Hospital. Besides his clinical duties, he's the chairperson of TTSH's Clinical Ethics Committee and a member of the Clinical Steering Committee of the Singapore Hospice Council. He is an advocate for humanistic care delivery and has contributed to various research publications that focus on integrating palliative care services to create a more seamless care journey for our patients. Next, I have Prof. Tam, who is Senior Consultant at the Emergency Department of Tan Tock Seng Hospital, a multi-award-winning educator and founding member of the Lee Kong Chian School of Medicine. Today, she joins us not only as a distinguished clinician and educator, but also as a caregiver who has experienced the caregiving journey firsthand. Next, I have Dr. Hao, who is a senior colorectal surgeon at Tan Tock Seng. You can see Henry clapping for Dr. Hao over here. He doesn't just cut and stitch intestines with high-tech tools, but he finds greater satisfaction in helping his patients literally bounce back faster after surgery through major programs like ERAS, the Enhanced Recovery After Surgery program that he helped to establish here at Tan Tock Seng Hospital. Finally, I have Alicia, who is a music therapist currently working with AWA. Currently, she works at AWA School at Bedok, a school that provides special education for children with autism. Through music therapy, Alicia provides a safe, welcoming environment for students to work on various goals and skills, using music as a tool to engage, empower, and enhance the lives of her clients. So, would you join me in clapping and welcoming our wonderful panelists? Thank you so much. Okay, so we're going to start with a warm-up question. It's quite an interesting question to ask. No one has ever asked me this before, okay? But I'm going to ask my panelists, how human are you feeling today? Give me a number between 0 and 10 and tell me why. Anyone would like to answer first, or we can just go down the road? Okay, Dr. Hao?
Ladies first.
Oh.
I was feeling sad and I'm feeling sick. Yeah, I'm feeling really happy today. It's a Friday afternoon. Actually, for school, it is the last day of term. So, yeah, I'm looking forward to the weekend. Yeah.
The other lady.
Probably 9 to 10. This week has been a very good week working with a group of nurses. We have a big project lined up in front of us. There's a lot of excitement, positive energy, and I think the good feeling about being human is, for me, is not about myself, but being a part of a larger project that will benefit a lot of other people.
So I would hesitate to put a number to how human I feel, because I feel that I'm human every day. Because as a human, I think I feel highs, I feel lows, and that's exactly how a human should feel emotions. You can feel happy, you can feel sad, you can feel angry. And fortunately today I'm happy and I'm very excited to be here. So I think that's as human as I can be, as I feel on a daily basis. Thank you.
Thank you, thank you.
I'm going to say I'm 7. It's not just today, it's a regular kind of a thing, right? More because that's how you define humanity and being human. I'll elaborate later, so why I think it's a long content topic.
Being human. I am a human lifetime. But if you look at the number, I only can put in such a way that before I became sick, afflicted, I was doing many things like what you all are doing. Timeline, schedule, work commitments, family commitments, and so on. So that put me probably around the 5. But what happened is after last year that I got afflicted and I get well, thanks to Dr. Hao, I changed. I think I probably put it as 7 or 8, 9. And then I was invited to be the support group. It shows that I'm becoming more humane, maybe, but because that what I've gone through, I can share with others. So I probably put it at the 8, 9, 10 is almost perfection. So I'm going to put it as an 8. Thank you.
Thank you for sharing. And of course, again, now I also want to include the audience here. Can you show me your hands or fingers? How human are you all feeling today? I want to get a rough gauge. 10! Whoa, probably 10. Okay, I see a lot of 8, 6, 3, 10. Okay, very, very good. Okay, so I think a mix. Hopefully after this event, 10 also over there. So hopefully after today's event, the numbers will go up a bit. Okay, that's my hope. Later, after at the end, I'll ask you all again. Okay, let's see more plans over here. Okay, so let's move to our first question for today. So, humanistic care can be a very big term or word. You know that it might seem like a lot of people just throw around the word humanistic care. What does it mean to you and the work that you do? Of course, Mr. Henry.
Good question. Right now, actually, I'm kind of retired, and so I'm working some time in support group. So I was thinking that maybe there's an increase of 0.5 because I feel actually in the long term there will be and there are patients who are in need of information and support. So more or less, maybe the support group started only about last year. As I have seen the real life experiences, spoken to patients, ex-patients, and I can relate to them. And I think that we all being human, okay, even you are right now working in a medical profession as a nurse or a doctor, you're occupied with your schedule, your timetable, and improvements in this and that. Don't forget, we are the patients, we need your touch, right? Sometimes a little hello, a little touch can make a lot of difference. I saw this because when I was recovering and I met Dr. Howe, and I find it very intriguing. He straight in the face and said, no problem. I was, what is it, man or what, you know? But then after that, he has dealt with me, and thank God, I also recovered from the ERS program. And I recovered with no other treatment, like chemotherapy or whatever it is. That's surgery. I felt grateful, okay, to him and Uncle Steve. So that's why I agreed to join in the support group to try to give whatever available assistance to the group. Thank you.
So obviously I'm the dedicated of department, like some sort of palliative care. Honestly, this aspect of humanistic care, or what palliative care we call person-centered care or restoration of personhood, it will be easily a 1-hour lecture, to residents and all that. So to compact it down, I just want to draw an example that many of you will relate to as healthcare professionals or patients or carers. So there will be situations whereby we know our patients are suffering from advanced illnesses, maybe cancer or maybe end-stage organ failure, and they will tell family members or their doctors that please just let me die, give me a shot and let me go, I don't want to live anymore. Right? It is not uncommon. Right? As to whether they truly mean that or it's just a appeal for help, it's on an individual basis. Some of them really need that. Right? We are fortunate in Singapore because we have very good access to analgesia, medication, technology, good governance. In our regional countries, they do not have even morphine available, and many actually commit suicide because of cervical cancer. Right? So there is this movement in the psychiatry circle in the year 2000s, whereby they looked at actually these patients with cancer especially, who asked for euthanasia in the Netherlands, because that's when they started to legalize euthanasia. So a psychiatrist, a very senior one, called Professor Harvey Schwarzkopf, right, started this work on what is personhood, because they start to analyze why do these people want to die. To commit suicide or to ask for euthanasia is the elimination of what we want to be a human. We just want to eliminate this person away, this existence away. We want to wipe out. What makes someone so upset that he wants to wipe out his entire existence away? So the study then came on and evolved in literature to what we call personhood. So what's personhood? Personhood is what we identify to be ourselves, be it our physical appearance, be it our feelings and sensations about our roles. For me, maybe a doctor, a father, a son, or for you, maybe something that's very important. Right? And when sickness and illnesses surfaces and presents as a crisis, and you suddenly lose all these things, you look different, you can't care for yourself, you can't present and function in your role as a father, as a very effective employer, or as a son, blah, blah. And all your whole identity fractures, especially if it happens over a very steep and short period of time. So why do people want to commit suicide? Because they cannot reconcile the person that they were 6 months ago and the person that they are now. And they can no longer stand this existence and this new identity. They divert this anger inwards and they want to eliminate this very person that they can no longer tolerate, which is themselves. So what is humanistic care and active medicine? Is to restore this personhood to at least to a point that they can tolerate and feel life is worth living. Be it restoring basic personhood in terms of hygiene and facial expression, facial appearances and all that, or just masking smell from a gangrenous foot, relieving pain that's persistently disturbing the senses so that you can't sleep, or trying to restore function so that they can go back home and feel some sense of normalcy in the home environment, or even back to work. So that's my life, my department's life as a palliative care healthcare team. Thanks very much.
Typical emergency physician, I'm going to have it a lot shorter. So the analogy I draw when I think about humanistic is, all of us know the sun is this entity up in the sky. When it's daylight, the sun is there. But there are days when you know the sun is there, but you don't feel the warmth and you don't see the light. So to me, humanistic care means, if I'm the healthcare provider and I represent the sun, there should be the appropriate amount of light and warmth I bring into the interaction with my patients. If you've traveled to winter countries, when you are still in the warmth of your room and you look out and the sun looks so brilliant, then when you step out without the appropriate clothing, the shock of your life with the cold. And that's not what we should be giving to our patients. Humanistic care is about the warmth and the light that must come with the sun. If this is the analogy I want to use for healthcare delivery. Thank you.
Very cheap. When I started, I was in medical school. I actually worked with Prof. Tam. She was a physician, I was a medical student, and we did a study of diabetic patients. But that's a snippet aside. So what does humanistic care mean to a surgeon? I think surgeons, typically you see, you watch all these K-dramas or you watch these movies, they're very action-based, they really want things to get going, it's very dramatic. But in actual life, a surgeon, really wants to get his or her patient up and going well, back to his normal life. But in a daily setting, we have so many patients, and sometimes our patients become a big number. Our patients sometimes become a disease condition. Right? But at the end of the day, I think what we need to understand is that every patient is somebody's son, father, mother, grandparents, and that's how I think we should regard each and every one of our patients. There's a lot of things that as surgeons we want to do, but sometimes we will not be able to do so. So my mentor, when I first started, he once told me, that as a doctor, not just a surgeon, it is only possible to cure sometimes, but it is possible to relieve often. But most importantly, it is always possible to comfort always. So that's the relationship that hopefully surgeons can develop with their patients, and even sometimes in certain cases, we're not able to cure you or cure the patient, we can provide relief. Most importantly, we can provide comfort. And at the end of the day, as a surgeon, if I get my patients well again, it is important that we maintain this relationship. I'm very lucky to have superstar patients like Henry, Prabhu, that even after surgery, so long, we have managed to continue in a relationship, in a friendship. It's not so much a paternalistic doctor-patient relationship, but a continuing friendship or relationship that we continue to grow. So that to me is humanistic care as a symbol.
When I think about humanistic care, I think there's a tendency to think of, what do I need to do to provide humanistic care? But I think it's more of how I am as a person and how I see the world around me. Like, not just to patients, my clients, but even to people that I'm walking past on a train, in the streets. How do I see people in general? Do I see them as worthy of respect, worthy of dignity, worthy of volition? They're able to do their own things. I'm not an expert in whatever I'm doing. For them, they have a say in their own care. They have a say in what they would like to work in during therapy sessions. And I think having that thought of how I see the world around me and how I see people around me sort of informs the way I conduct music therapy sessions. And I think that's what humanistic care is about. It's really about you as a human, how you value people around you.
Today is supposed to be ERAS Awareness Day. ERAS is Enhanced Recovery of Disability. So ERAS looks a lot at outcomes. We look at when can the patient go home after surgery? Are there any complications? Or is there any pain? Right? But more and more we realize that it's not just enough to look at these outcomes. We want to look at what really matters to patients. Outcomes that matters to Henry, to Prabhu, to many of my patients, to any of you who have been a patient. What is it that really matters to you? Is it the quality of life, function? And therefore, how ERAS is relevant to today is because we're starting to look more at outcomes that really matters to our patients.
Thank you all so much for sharing. One thing I love about this audience is after every single panelist shares, all of them clap. So encouraging. Thank you so much for that. Okay, so I'll move on to the next question. So the next question is, why is it important to focus on humanistic care, particularly in today's context? And are we saying that we are not human or we are not delivering care humanely to our patients? Yeah. Anyone can please feel free to answer first.
Okay, I'll go first, right? So, I think in this age, I think a lot of us are talking about high-tech stuff, right? Not just digital, not just mobile phones like AI and so on. But when it comes to doing high-tech, there's a term that's called high-tech, low-touch, which means that we become more and more removed from actual caring and touching and caring for the patients physically. So I think it is very important that in this age of digital technology advancement, that we want to be high-tech, but at the same time, we want to maintain that high touch, right? To make sure the relationship between the patient and the doctor or the clinician does not get removed. I mean, how many of us actually go onto a website or a mobile app and start chatting with this person, not realizing that actually behind is actually just a chatbot, right? At some point until they say, do you need help with further assistance, then you're directing to a person. So I think it's very important in this that we maintain this very close relationship with our patients despite digital technology.
Okay, humanistic care, right? Now, this is my opinion. You want to find humanistic care? Go to the Ministry of Health, healthcare workers, all right? This is what I have taught the healthcare workers, nurses, the doctors, surgeons. Which ministry can you find such compassion, such caring? Of course, there will be some people who not fall into that category, but there are many who fall into this category. My experience in the world, I have experienced some good nurses, some good doctors, and they make a difference. That's helped me to recover. Like
I didn't pay him anything.
some nurses also impresses me. You know, sometimes small requests, can I have a cup of coffee? They will attend me. You know. So mine today is about those good healthcare nursing people. All right. Look at it in a way that you are in this industry. We are your byproducts, but we are your patients. We need you. All right. So someday, you know, when you fall back into our category, then you really know industry I know is under the Ministry of Health, has all of this. All right? So I thank you from the bottom of my heart for all of you.
I'm going to be quite cliche here. So but it makes perfect sense. We are facing an aging population. The average life expectancy in Singapore now is, I think, 85, yeah, higher than the previous 83 already. And Singaporean males are hitting about 80, 81.
All the stats.
But the last 10 years of the male's life is going to be highly filled with morbidity. Right? The ladies live longer. Some people conjecture that's because as ladies with a nurturing figure, they are more emotively connected with the family and they have more meaning to live on. Whereas the males, after they end their career and retire, they have no meaning to live on anymore. Not well loved by wife, and not loved by children. So anyway, yeah, so my point is that people will grow much older. There will be a greater rise in comorbidities, with multiple concurrent chronic illnesses, cancer including all of them. And there will be greater complexity of clinical situation. There will be many more clinical options to treat cancer and non-cancer conditions. But people will become older and frailer. And you look at our population in terms of carer, the number of children that supports elderly parents are going to shrink. We know that, right? So when people are older, frailer, more diseases and more treatment options seemingly, but lesser people to take care, there will be a lot of social and medical challenges that will rise in the healthcare setting. So in this situation, what patients need actually is clarity. Right? Clarity not in terms of a doctor that comes by and tell you if you have this illness, what is the likelihood you survive in 5 years, what is the treatment that you need, what is the complication by probability. It's not what patients want. Patients want a doctor or a nurse or social worker that works in a family conference, tell them for you as a person, not any other average person, but you, given your situation, your health condition, your family, your social structure, this is probably the best option for you because and these are your value system, is it aligned? So we need to come down to a point whereby we can speak person to person, not just doctor to any other person, but healthcare professional to any specific patient. Right? And align our thought processes and decisions according to what this particular patient would most need from the healthcare system. That's number one. Right? You need to go straight down to individual level to help make sense of the complexity. Number two, in today's rapidly progressive world where everyone is just on the phone all the time and you Google and check GPT all the time, people tend to cope very cognitively. So when you present with a crisis, younger people nowadays just Google lah, check GPT lah, find out what is the best option or new option, stem cell lah, CAR-T lah, what have you, right? And then they cognitively cope with these challenges by finding solutions. Right? So as palliative care physicians, when we go to a family conference, we're very wary of a few professions because they think too cognitively, right? Engineers, teachers, lawyers, auditors. Because the training makes them so rational and so cognitive that they do not connect with emotions inside. And increasingly our population will be like that. They are ultra-rational, ultra-logical, to a point where when they face a crisis, be it to themselves or to their loved one, they cannot connect emotively and handle that grief. And that's why as healthcare professionals, we must be there, particularly when there are very few families going to be there in the future to support this grief. We have to be there to hold that suffering and make sense of that suffering for them.
I'm going to start with a story with my late mom. My late parents were both patients of convalescing, and my late mom, and this was a hospitalization before COVID. I think she had a fractured neck of femur, and so she was, the surgery was done, and I came by to visit her. So after I was alone with her, because I think the nurses were serving or had just cleared the dinner away, she told me in Cantonese, she asked me, why did the nurse clean her hands and wipe down the BP cuff after taking my BP? I bathed every day, I'm very clean. So remember, this is before COVID. So I explained. Then she said, oh, understand. But you see, to my mom, it was an insult. Okay? She, being a layperson, couldn't and didn't understand what infection control was all about. But after explaining, she understood. So the thought that I brought with me after that visit and encounter with my mom was that the technology that we have still will have a place for healthcare providers because we explain. So now what I do is, whether most of the time it is a straightforward consult, because strangely, the more acute the illness, the less anxious they are. The less acute the patient, the condition, the more anxious they are. So I usually end up answering a lot more anxious questions about a sprained ankle that has got no fracture, compared to my multiple trauma patient who usually don't ask questions anyway. So I make it a point, after the x-ray comes out, to turn the x-ray panel and briefly explain what I'm looking for in the ankle region to the patient. And if they want to take out a handphone and take a photograph of the x-ray, I would say, go ahead, okay, because it is their x-ray. I know we have a lot of regulations about the information actually belongs to the healthcare system and all that stuff. But to really deliver that kind of care that's person-centered, I believe the patient should take out a handphone and take a photograph of that particular x-ray. And that's how I translated into what humanistic care means when I take on a consultation and speak to patients.
We're talking about why we think humanistic care is important, especially in this day and age. And especially I feel living in Singapore where everything is very fast-paced, very driven by tech. Everything you want to whip out your phone and quickly find an answer to. I think it makes us very time conscious. I think even when we watch YouTube video, you cannot wait 5 seconds for an advertisement to end. You want to have 6 So can you wait 5 seconds for your patient to respond to you? Can you wait 5 seconds after doing something to let them process that thought? I think that's time that we have to learn to slow down and give ourselves and give the people that we work with. I think technology should be an enabler. It should help us do our work better, and it should not, like you say, decrease the contact time we have with the people that we work with. I think another cliche is a bit of a double-edged sword. Sometimes technology helps me in my sessions. For instance, in a session when suddenly this client tells me, oh, I would like to listen to this song, and I don't know this song. I can quickly take out my phone, find the lyrics, and let's have a little bit of discussion about why the song speaks to you, and then we have an in-depth conversation about it. Whereas if I didn't have my phone, I may have to say, oh, let's come back to this next week. But equally, maybe technology may be in a way, if I'm using, say, an app to help a patient with very little movement, to create music with that little movement he or she has, but then I'm like fiddling the app is hanging, and then that actually interferes with that therapeutic process. So I feel, we should use technology if it helps us, but don't be so quick to embrace technology if it's just going to hinder the work we do. I think we are human as we are, we can do our work without technology. But the technology can be for the administrative tasks. Also want to talk about how I feel in Singapore. I don't know if this is too broad, but we focus a lot on the outcomes, we do outcome measures, we have KPIs, but then we forget the process can be as important or sometimes even more important than the outcome itself. Take for example, if I'm working with a patient with low mood, so I want to improve her mood, right? Then I pick out this mood scale, the 5 phases. How are you feeling today? 2, sad. And then end of the session, 2, also sad. KPI not met. But actually, within the session, so many things could have happened. Maybe I sang a song that touched her, maybe she shed a tear, or maybe she gave a sigh at the end of the song. She didn't say anything, or maybe she did. She said no, like, do you want to play an instrument? No. But then, of all the things she couldn't say no to today, I was the only person that she was allowed to say no to. She couldn't say no to, I don't want this illness. She couldn't say no to the doctor. She couldn't say no to medication. But she can say no to, do you want to sing a song? So I feel like sometimes as a therapist, like I'm there for people, as a safe space for people to say no or to reject, and let them feel human, let them feel like I still have volition, I'm still able to have control over what I want or what I don't want to do. And I think maybe because I don't work in an acute setting, so that's the freedom I get to do things in a way that's a bit more humanistic. Thank you.
Such amazing things. Thank you so much for all your sharing so far. For my next question, I think some of you previously kind of answered and touched a bit on it, but please feel free to add on. on. So as healthcare technology continues to evolve, we might dilute the human factor in our pursuit for efficiency and automation. So with that in mind, do you feel like it's challenging to care or for care to be more humanistic in today's context? And if so, why? And please feel free to share some frustrations or challenges that you felt also. I mean, for me as a nurse, right, we all know the flow sheets and the care plans. My goodness, I mean, like, of course I know it's necessary, but sometimes I just want to go and talk to my cute aunties and uncles. I'm stuck X, W, and all. But yeah, so for me, I do understand certain frustrations, even though it's needed and necessary. So how do we then still be humanistic and find time, small pockets of time to do that with all this happening now?
I think you answered the question. We need time. We have to find time. So that's one thing that I really hope I have. I really hope to have when we see patients, to consult patients. A lot of times we have 30 patients in a morning session of clinic waiting to be seen. And really, there's just so much time you can spend on each patient, because certain patients need more time because the conditions are more complex. For example, if I need to operate a cancer patient, I need to spend 20 to 30 minutes explaining the entire process, right? Compared to a patient with maybe a small hemorrhoid or a bowel, that patient usually, unfortunately, just has about maybe 5 to 10 minutes of time. So we need more time. But unfortunately, with digital technology, and I think as Prof. Ang has said, we actually sometimes spend more time typing on the keyboard, not even looking at the patient. And in my daily rounds, when we round with my team, the junior doctor used to be the one that's supposed to examine the patient, talk to the patient. But now he just spends the entire session typing on the keyboard on what we see, what we find, how the patient feels, which is necessary, but unfortunately that takes away actually the real human touch that the doctor probably needs to have with the patient. So I think that's really challenging, and we need more time, but unfortunately we only have 24 hours a day, right? And I haven't come to a point where I'm able to find a solution how that can actually solve.
This thing about humanistic care is not about one healthcare professional doing one patient encounter. It is, right? But in order to foster humanistic care, it has to be a whole culture that changes it, right? I'll give an example of my palliative care wards, which we are hugely proud of, right? The nurses and the wards work very hard because these are patients who are in advanced illness, often on multiple infusion pumps for pain and symptom control, very anxious family members, or maybe even moaning and confused patients to complicate matters. Over the past few months, I've seen a consistent train of red apples, right, of compliments coming from family members. And despite their busyness, it is not as if they are not busy, but they purposely injected from point to point, a humanistic touch. Be it holding their hands for a while, talking to them in a very calm and reassuring manner, addressing the person behind the illness, and they can't do that just because I command them, or the nursing system command them to do so. The work culture has to support such a humanistic kind of behavior, by nurses support nurses, and nurses go into trouble, and other senior nurse steps in to intervene. If there's a potential case that didn't end well, there needs to be a debrief of the nurses to tell them that things are not looking good, and this is the reason why you can do it better this way, but actually this may not be our fault, blah, blah, blah. There needs to be an active, humanistic, and emotive culture that supports healthcare professionals to behave in a humanistic manner. Right? Secondly, humanistic care need not take up a lot of time. For example, I'm very proud of my colleague, Dr. Normastina in geriatrics medicine, but she brought in Namaste care. So the ward in ICH actually injected on a regular basis, I can't remember whether it's 15 or 20 minutes of contact time where the nurses just sit down and do massages for our elderly patients in the integrated care hub. And the experience is very therapeutic, both for the patients as well as the healthcare provider. You can Google Namaste care, but the very act of touching and massaging and that contact time makes us feel both more human. The patient feels like a human, not just a bag of disease organ. The healthcare professional feels like I'm a human delivering care, not just the machine or the typewriter or the person that keys in reports and orders stuff on the computer. And that requires a certain system leadership to be able to inject something that everyone can accept to routine and then foster a culture that supports everyone to do humanistic care. Thanks.
Okay, ladies and gentlemen, I think that I don't speak on behalf of you, but I sense that in work scope, you have so many things to do. Your timetable, your job, your responsibilities, they are immense. Okay, on to this gentleman, humanistic doesn't have to be one big thing. It can be very tiny, very small. Sometimes I see Dr. walking past me and give him good morning. Okay, to me it helps. It shows that I appreciate him. Okay, so you can do the same thing to your patients. As I was walking to the Consent main building, I saw this big wall where all the patients and organizations they like thank you to you. Okay, that is the humanistic care response from the patients to this establishment. Right? Like I said, thank you very much.
I should add something to say about social worker because I mentioned doctor and never say social worker. A social worker is trained specifically to handle this aspect of humanistic care, right? For example, our social workers in the ward, and social workers especially, would sit down, and find out exactly what this patient needs at the end of life. What is important to this patient? What are the last wishes? Is there a need for reconciliation with family members that haven't seen them for the longest time? Anyone needs to come and say sorry, say thank you, say goodbye, pay back money, which we've seen before as well. The person got to leave because the person still owes him money and haven't come by. These are important things that a social worker is extremely important at work to actually help. And this information that's elicited from the social worker comes back to the healthcare team for us and coordinate care in a manner that is aligned with what the family and the patient needs. So I think truly humanistic care is a multi-professional kind of approach. It can be done by any family group or any individual. Thanks.
So again, go back to my late mom and my late dad. Both of them are that generation where relating to healthcare professionals was a straightforward business. So they can name after their second day or third day in the hospital their favorite nurses. So I would ask, why do you like this particular nurse? She smiles, she chats, talk about inconsequential things, even though she's going to come and draw blood from me, which is painful. And all these are the little things that make that nurse special to my late parents. And so for me, here, of course, when my parents first told me those things, it's like, oh, it's really that simple to get a compliment, huh? Because the next thing I told my parents, of course, please don't take it as a compliment because that translates into something meaningful for the nurse, which of course they dutifully did. I wrote for her and she put her thumbprint down there. And it gave me a way to reorientate, for my work in the emergency department where long waiting time, long list of patients is the norm, that I should be the first to smile, which is a lot easier without a mask, okay, but then now the mask is there already. So the smile should probably come from my heart, okay. Be the first to say sorry to my patients, even if they only waited 15 minutes, okay. The word coming out from me first is, hi, why are you here? Rather, which is very restricted to business, but I'm really sorry we already waited 15 minutes, okay. We're really busy today, but I'm really sorry. And then, 90% of the patients, even if it's a 2-hour wait, if I say sorry first, the negative emotions come down. Okay, majority will say, okay, now we understand. And then, I get on with the consultation. Actually, most of them will say, doctor, we understand. If my GP didn't send me here, I wouldn't be here. And the whole consultation starts off on much more positive note. So, how humanistic care translates in terms of impacting my practice is, number one, smile. Okay, yeah. The ED is really such a stressful place. If the doctor doesn't smile, it's even worse. Number two, just start with an apology for their waiting, alright? Singapore is an instantaneous society. People expect service fast. Okay? They don't always see the complicated processes that we have. And yes, we acknowledge that technology that has helped in many ways does slow us down. I think, like Kimberly has said, and then of course all of us here, the amount of paperwork, the multiple screens you have to navigate in order to make sure that the information that you have is correct, and then of course the typing and the documentation. That, however, is not something that will go away. What we can change is how we start that first encounter with our patients.
And my first suggestion to Prof. Tam is not starting with an apology, because I'm trying not to over-apologize too much. I find that as an Asian, as in China, I don't say sorry a lot, I say thank you more. So I like to say thank you for your patience. So like, whether you're patient or not, thank you for your patience. Yes, yeah. So I try to start that if something goes late before I try. Yeah. And also I wanted to also feedback back to Prof. How that Humanistic care is being practiced in community care. Prof. Yeah, because I was looking in dementia daycare, and we do see Humanistic care being used for our patients, and it is very helpful, especially for those in advanced stages of dementia when you can't communicate through words, but you can communicate so much through simple touch. And on that thought as well, I feel touch is very important when it comes to providing care, and how the way you touch the client is very important as well. So sometimes when I'm doing staff training on how to facilitate music therapy sessions, for instance, let's say I say play the drum, and then the assistant or whoever's trying to be helpful and take their hand and play the drum, I'm cringe at it. So it's the intention to play the drum, but the intention is not really, the KPI is not the drum must be hit, but the intention is they want to participate, they want to facilitate that. So the way you should be holding the hand, to me that makes a difference as well. And even not just in elder care, but in school as well, do I just grab the student's hand to play instruments? And is there meaning in that? Or do I try to facilitate? Do I try to encourage, or do I try to take that no at face value and say and acknowledge, no, today you don't really want to play the drum now. So I think touch is very important, and things that I would say to care facilitators and the things I work at would be like, even the way you take the lanyard from them, even if you know they are in advanced dementia, they don't really know the lanyard is being removed, but you just go and remove it from the back, or do you go to the front and say, I'm removing our lanyard for the day. I think all these little touches actually matter. And I think all these actually affect someone's mood for the day. If there's something removed from you suddenly with no preemption, then you would be like, what happened? Yeah. So I feel, like I said, humanistic care doesn't take a lot of time. Some parts of it does take a lot of time, like the FaceTime we need, and the time we need to talk to our colleagues in the multidisciplinary team. I think that's time that's always very precious, but then yet we don't have enough time to come together as a team to discuss together. Sometimes I used to work in a community hospital, I had to talk to the medical social worker as well. Sometimes things that they won't tell the social worker, they may end up telling the musician because I look very harmless, right? Sing song only. Then all these things start coming out, sing this song, it reminds me of so and so and so. So sometimes we need to talk behind as well, but that time to find together, I find it's hard to find time together. But those are the important pieces, and we need to schedule time for that to talk, not just to the patient, but to each other as well. So back to your question about some of the frustrations, time is one of them, and my boss is around, so I better say no time. So we try to prioritize our time and put the time to where it matters.
How you talk about the palliative ward setting, and we talk about how patients can play a role. Actually, one thing is I want to sell for you the ERAS ward, right? How we try to think out of the box, right? Because our normal recovery process is, you sit in the patient in the bed, sit in the chair next to it, have your meal and everything. But we want to increase that soft touch, the human touch. And therefore, we thought out of the box and said, how can we increase human interaction? So we had set up, those pop-up communal dining areas where patients come together, talk to each other, and go back to almost a sense of normal. Because in society, in community, exactly, right? Family, friends, you eat in a coffee shop, you eat around the table. So we try to create a sense of normalcy for them to try to get back to normal is, the patient support group that for colorectal surgery, prostate cancer, and breast cancer, they are actually people who have a huge source of experience, of valuable advice they can give to the patients, more than actually myself, because they have gone through it. So I think that is how we can maintain that human touch despite increasing technology use.
Thank you for sharing your stories, as well as some useful tips that you can take to bring home, or even for our programs as well. So sadly, we've come to our last question that I have for this panel discussion. Okay, so part of being human is about being imperfect, and part of being imperfect is being forgetful, relatable. If everyone in this auditorium forgets whatever we just discussed, if I was there and I snapped my fingers and all your memory gets wiped out, right? What is just one take-home message you would like the audience to bring back home today? It could be a useful tip, or just one take-home message.
Be the first to smile and be the first to greet the other person. I think for a lot of my colleagues from Tan Tock Seng, you are as senior as me, or nearly as senior as me. I think sometimes we forget the tremendous power differential that is between us, who are senior enough, and our younger colleague, our nursing colleague, our other non-medical colleagues, and especially patients. I think being the first to smile and be the first to greet and say good morning or good afternoon brings us a big step forward.
I think for me, the advice is to fellow healthcare workers that I think in order to make sure that the human part of us stays within our care, I think sometimes even in the rush of work, imagine that the patient sitting in front of you is a friend, a relative, and how would you want a friend or a relative, a loved one to be treated is how you should treat this patient.
Actually, quite similar. When I'm doing training, I do this visualization exercise where imagine you're Akong Ama in our daycare center, and imagine this is the way I do certain action, or this is the way you've been done. Like, how do you want to be treated? Like, when you think about how you want to be treated when you are of a certain age, and maybe that's the way that we should be treating the people that we work with.
I'll share a habit of mine that may not be so consistent. I try. So I set my phone alarm every 2 hours during office hours. Every 2 hours, my alarm will ring. As long as I'm not engaged in anything too busy, right? I'll just walk away somewhere, do some mindfulness practice, close my eyes, and just breathe. So that pause is important to halt all the cognitive chaoticness, come back, anchor, and connect with yourself. When you come out there, you'll find that actually you're able to extrapolate that kind of connectivity to the person that you next encounter, be it your colleague, your junior, or your patient. You just consistently practice that.
Okay, in your work, you will meet all kinds of people, good, bad, ugly, no matter what. I can see some of you have the frustration, some of you try to be patient and so on. But we are humans, you are human. All I can ask you is that the takeaway from today onwards, when you look at a person, no matter what it is, show a little bit of love. Just be kind. Be yourself. Okay? Thank you. Thank you for Mr. Prabhu, Mr. Chu, and Alan, and the rest of my
And I would like to add on also as well. I recently heard this from a doctor. So I think beyond just treating our patients as humans, and like being humanistic in the way that we care for them is very important amongst healthcare professionals as well, to remember that we need to be humanistic to each other too. So one small tip, right, I think that is very, very useful, especially for those who are in the wards, especially with our HOs and MOs. A lot of times we don't get each other's names. Doctor, nurse. One of the smallest steps, right, that I feel like is so useful is just to get each other's names, not just obviously to ask, doctor, can you please help me order this thing, but even just like, doctor, hey, you just came back from your break, or have you had lunch? I think it goes beyond. If a doctor addressed me as Kim, compared to if he just nurse, I feel like it's just such a small, personable thing, but it really makes you feel seen, which you know is very important, especially in our profession. Yeah. Okay, so there's a small tip for everyone to remember. Yeah. Thank you. Yeah. So with that, we've come to the end of our panel discussion. Please give it up for all our panelists. That was such a wonderful session. Yeah, absolutely the Avengers here. So we will now be presenting our panelists with tokens of appreciation. So could my panelists just kindly take a few steps forward?